Today on Talking Solutions, I'd like to welcome in Heather Shoop from West Care.
Thank you for having me.
You guys do such great work within the community. Today's topic is suicide prevention here in Nevada. I don't think anybody really wants to have to think about that, but it's something that we deal with. I don't think I'm alone in that. I've got people who have been within my circle of friends who we've lost, and by the time it actually happens, there's no fixing it. How does West Care deal with suicide prevention issues?
I'm actually a trainer within West Care. I provide suicide prevention training to our West Care staff. I teach a program called Safe Talk, which is by Living Works Education, and Safe Talk is about suicide alertness. So it's about learning how to be alert and aware of the signs that somebody may be struggling and how to connect them to help.
That's going to be really useful for all of us to know.
West Care Nevada is a member organization of a statewide coalition that I also chair called the Nevada Coalition for Suicide Prevention. And so they have representation on our coalition and are really part of starting to develop a statewide solution to the problem.
You know, I wonder, is Nevada alone as a state that would have this kind of resource?
I think all states do it differently, and they have different services and resources that are available based on their needs that they have. In the state of Nevada, we've had a state office of suicide prevention since 2005, and that's also the year that the Nevada Coalition for Suicide Prevention came on board, and really has only been about 10 years that we've really had these resources, kind of grassroots on the ground, that are working on solving some of the issues that surround suicide, and West Care is certainly a part of that.
Well, in the formation of an Office of Suicide Prevention, like you had mentioned for the state of Nevada, someone must have seen a need for that to come into being.
Absolutely. We had a really amazing group of lost survivors who were very grassroots on the ground trying to get things done. And for the listeners that aren't aware, a lost survivor is somebody who has survived the loss of a loved one to suicide. There's a wonderful lady named Linda Flatt who later worked for the Office of Suicide Prevention, but was really the mother of suicide prevention in the state of Nevada and is a lost survivor herself and happens to be a personal mentor of mine.
Well, when someone in your life, and I had a friend, a former boss here in Las Vegas who had taken his own life years ago, it's such a helpless feeling. Because if we would have known, and that's what you're here to help us figure out, is those signs, things that we should notice, the things that we should be aware of. Also, being that you're with West Care, for anyone who isn't aware, I know West Care's been around in Las Vegas for ballpark 40 years.
Since 1973.
And you have a lot of different services that you provide to the community.
Sure.
For people who perhaps have addiction problems, I would imagine that people who deal with suicidal thoughts and issues, some of those things that make it more likely they might consider taking their own life.
Absolutely. Substance abuse, mental illness, those are risk factors. Depression is certainly a risk factor. Problem gambling, which we know is prevalent in the state of Nevada, is also a risk factor. So there are certain things, when I say risk factors, those are things that make it more likely that someone will have thoughts of suicide or maybe attempt suicide. So certainly a lot of the problems that clients come to West Care with make them at higher risk for thinking about and possibly attempting suicide.
Here's a weird one for you. I have a medication, and I think a lot of people will be on some kind of a prescription med where in the patient instructions, which we're all supposed to read and be aware of, I don't think most people do.
Mm-hmm.
One of the things that I take on a weekly basis says, if you have suicidal thoughts, because some medication apparently can take and tip you in that direction as well.
Mm-hmm. I don't know all of the science behind it, but one of the theories that I have heard about that is if somebody is on a medication for, let's say, depression, and depression often causes somebody to be very low energy. One of the theories is that there's a possibility that once the person is on that medication, they have more energy. And so they may not be completely out of the woods with their depression yet, but they have more energy to carry out a suicide attempt.
Boy, and I take an MS drug, and it has that on there. And
Sure.
I don't understand why. And by reading the patient instructions, I don't believe that I'm in the ballpark of people who would think about taking their own life.
Mm-hmm.
I am so in love with life, I can't really see that happening. But I am aware that the medication does caution that you may have these thoughts as a side effect.
Sure. What you said a minute ago really makes me think anybody can be at risk. So I could be sitting here today in love with my life, which I am, and there are all kinds of things that can happen in our lives that may lead us to think about suicide. So I think anybody can be at risk for suicide, but also anybody can be a part of the solution when it comes to preventing that from happening in our own corner of the world and then throughout the state and throughout the country. We all have a part in it.
You mentioned problem gambling being one of the things that might push someone over the edge to take their own life. And on the news, far too often, we'll hear about someone jumping off an overpass bridge, or most recently, there was some story about a couple who had taken their lives by jumping off of a parking garage. I won't even say which one, it doesn't matter. But those stories in our local news are all too common. And it's just the fact that they felt that that was the answer is the saddest part of all.
For sure.
And as you mentioned, the suicide survivors are the people who are left behind. Heather Shoop is with us from WestCare. We're talking about suicide prevention. We have some good information on that coming up, so I do want to let you know that I can't wait to talk about that happy upside of it. It's something that is important for all of us to know, and I would imagine that you deal with these issues far more than most people. When it comes to knowing the signs, for the people who we work with, our friends, our neighbors, our family, are there some signs that we can watch for?
Absolutely. One thing certainly is if somebody's talking about suicide, if they're looking for means, if you happen to see a computer screen popped up where they're looking at guns, and this isn't somebody that has been interested in guns before, if they're looking for ways that they could utilize to take their life, certainly we want to take that seriously. I know a lot of people believe that if somebody's talking about it, that it means they're less serious about it. But really the bottom line is anytime we hear somebody talking about suicide, we need to take that seriously and to get that person some help. Anytime we hear somebody talking about feeling hopeless, feeling worthless, like they don't matter, their life doesn't matter, those are certainly also signs. Somebody that may be behaving in an angry manner, recklessly, somebody who is withdrawn, particularly somebody who used to be kind of out and about and was social. When you see a person like that who's sort of withdrawing from friends and family and withdrawing from activities and not replacing that with other things, that's something to be concerned about. Another thing is if you know somebody who's been very depressed and suddenly they start looking a lot better, they seem a lot brighter, they seem like they feel better, that's something we really want to pay attention to as well, because what that can sometimes mean is that that improvement isn't really about a real improvement. It means that they've made a decision and they have a plan. So we want to be looking out for all of those things. Also, anytime somebody's had a loss in their life, and that could be any kind of loss. It could be financial difficulty, loss of a job, loss of a loved one, loss of a pet, loss of a home, loss of freedom. Many of the clients that WestCare works with facing jail time or prison time or things like that. Certainly, any type of a loss can be a huge risk factor when it comes to thinking about suicide. So it's really about looking at all of those things that are going on with a person, and we have to pay attention to our own intuition. It's a powerful tool because we may not necessarily be able to articulate sometimes what we're seeing or why we're having some of the concerns that we are, but just being able to pay attention to our own sense of this person and what we know about them is really powerful.
What about relationships that come to an end? I would think that that would be the sort of thing that would make some people say, I can't live without them, and really mean it.
Absolutely. And certainly that fits into the category of loss. Anytime we're losing a person that we love, either to death or because a relationship is ending, those are critical times that we want to make sure that we're there for the people in our lives and that, we're supporting them and paying attention to what's going on and being alert to those warning signs that may indicate that they need some additional help other than just our support.
We're talking about suicide prevention on today's Talking Solutions with Heather Shoop from WestCare of Nevada. Love WestCare. I can't say that enough. Now, you've been telling us about some of the warning signs or things that we should notice in the people in our circle. If we start to notice what we would consider a warning sign, what do we do? If we have a friend, for instance, who's experienced a loss and is rightfully feeling depressed, what do? Do we just reach out and make sure that they know, look, you matter enough to me to where I'm paying attention to you and I can see that you're hurting and I want to know if you are okay. What do we do from the side of the person trying to prevent that individual from taking their life?
Absolutely. So the first thing I want to say about that is, we talked earlier about anybody can be at risk, but also anybody can be part of the solution. And so before we ever start having concerns about somebody, just knowing that we have a part to play in preventing suicide, go to a training. There are very affordable trainings that are offered all throughout the community, all throughout the state with regards to suicide prevention, being able to intervene, that are taught by the Office of Suicide Prevention and the Nevada Coalition for Suicide Prevention. So I recommend to anybody, whether you're a mom or a neighbor or a hairdresser or whatever your profession happens to be, it's not limited to mental health professionals, because a mom is going to be able to see something going on in her child or in somebody before a mental health professional may be involved. So it's really about arming ourselves with as much information as we can as a preventative measure, just so we know what to do if we do have somebody that we're worried about. We want to be really clear. First of all, we need to ask a question. And it's a question that's really hard for people because we don't typically like to use the word suicide. We don't want to use the words killing yourself, but we have to be very specific about what we mean. And so the best thing to do is really to go to that person and say, I've noticed lately that you've really been withdrawing from friends and family and you haven't been going to work as much and you just seem kind of down. And, sometimes when people are going through those things, they may be thinking about suicide. Are you thinking about suicide? And really using those things that you're concerned about to frame the question instead of coming right out and just saying, hey, I've been going through some stuff. Are you thinking about suicide? It's an easier way of kind of bringing them into the conversation too and just letting them know that we care enough to pay attention and that we care enough to ask the question. We can ask them if they're okay, but that's an easy out for them. And somebody who is experiencing thoughts of suicide needs us to give them the permission to talk about it. There's still a lot of stigma and taboo around suicide, just as there is around substance abuse and problem gambling and, many of those other issues that people have difficulty talking about. So if we're concerned about somebody, we really have to get through our own sense of fear about using the word suicide. If you ask the question, are you thinking about suicide? You're not going to plant that idea in somebody's head. And that's one of the reasons why I think people don't ask sometimes.
That was what I was going to ask you.
There are a lot of misconceptions out there about using the word suicide, about asking those questions, and really kind of dancing around the issue. Research does not support the notion that we're going to give somebody the idea if we ask them the question. If they're thinking about it, they're thinking about it. And if they're not, just because we say, hey, are you thinking about suicide? It doesn't mean that somebody's going to go, I hadn't thought of that. That's a great idea.
No.
And more often than not, people are going to be really appreciative that you're willing to ask them a hard question like that, whether they're thinking about it or not.
Because it is a hard question.
It is.
But it's a lot harder to be a suicide survivor after you didn't ask the question.
Yes, it is.
That would be the kind of guilt that I think I'd carry for a very long time.
I have experienced suicide loss with 4 different people in my life between 2001 and 2009. Before I got involved in suicide prevention work, before I got any training, I had to forgive myself because I did the best I could with what I had at the time. And as suicide loss survivors, it's a more complicated kind of grief that we go through because there is that element of who are you angry with? Are you angry with yourself? Are you angry with the person? What could I have done differently? So there's that guilt that goes along with it. And it's much more complicated than if we lost somebody in another way. Being a suicide loss survivor is hard, like you said, and there's support out there. We do have really wonderful suicide loss support groups in the community and across the state that I really recommend people access, whether they're 2 days into their journey or 20 years into their journey. It's a resource that is very, very helpful and one that I wish I had known about at the time.
But it's there now.
It was there then. I just didn't know at the time.
Well, that's what we're here to help spread the word on.
Exactly.
Heather Shoop is with us from West Care. We're talking about suicide prevention. Heather, you had mentioned for people who are perhaps seeing the signs in someone that they care for, acting suicidal, maybe leaning suicidal, whatever, that we need to use the actual word suicide. Don't be afraid of it. Bring it up. That really shows that you care.
Absolutely.
And there are trainings out there that are very low in cost, perhaps some that are even free of charge. Also, also for people who are suicide survivors on the other side of that, to help pull them out of that guilt and the blame that they might be laying on themselves. And to get through that, we will put links for suicide prevention, also for suicide survivors on the Talking Solutions Facebook page, along with a podcast of today's discussion.
Fantastic. I would like to give a resource if there is anybody who's listening who is concerned about themselves, who may be experiencing thoughts of suicide, and that is the National Suicide Prevention Lifeline. It's a resource that's available 24 hours a day, 7 days a week across the country, and I know a lot of the folks that answer the phones for the National Suicide Prevention Lifeline out of the Crisis Call Center in Reno. That number is 800-273-TALK. That's 800-273-TALK. That's 8255. That is a number that I often recommend. Because of the work I do, I get calls from friends and family and coworkers probably 2 to 3 times a week saying, I'm worried about my kid's best friend, or I'm worried about my sister. What can I do? So I give them that number. And as you know, somebody who is a caring and concerned friend or family member, you can also call that number and just ask them what you can do too.
National Suicide Prevention Lifeline is 800-273-TALK, 800-273-TALK. Once again, we'll put it on the Talking Solutions Facebook page. Heather, I remember when I was a teen, everything was like, oh, my life is over. I think in the days of social media, in the days of 24/7 bullying online, I think that some of the issues regarding suicide, even with kids, that's really heartbreaking. But I don't believe that the stuff that we were talking about back way long ago about my life is over with everything, that wasn't serious. Where do we cross the line from our teenage kids, especially girls, saying my life is over to where they say something or act in some way that really does give us concern? Is there a difference between the two?
I've heard lots of stories. I have a lot of friends who have teenage daughters, and it seems to be when they hear something they don't like, it's, I want to kill myself, my life is over.
My jeans don't fit. I can't do this.
And I think it's really a matter of having open communication with them and saying, I've noticed when you get upset, you say, I want to kill myself. Do you really want to kill yourself? Or is that something that you're just saying? And if you ever have had feelings of wanting to kill yourself, if you ever had thoughts of suicide, let's talk about that.
That's a good idea because it opens up the opportunity for the conversation.
Yes.
And especially with kids. We should not be afraid of using the word suicide when inquiring with someone in our circle of friends or family or whatever. We should go ahead and say the word. That is not going to make them suddenly go, oh, I hadn't thought of suicide. Maybe I should. It doesn't work that way.
It doesn't work that way.
Heather Shoop is with West Care. We're talking about suicide prevention today. One of the things, Heather, that made me really interested, and I apologize, we should have had you in here talking about this topic long ago, and I pledge to you that we will keep a continuous dialogue going.
That sounds great.
A bright spot in my day was when I opened the email from Amanda with the Ferraro Group to tell me about this opportunity to talk with you. And she was mentioning that Nevada's suicide rates actually have improved.
They have. Historically, Nevada, we're in the top 1 or 2 for a lot of things we don't want to be in the top 1 or 2 with. Certainly for as long as we've been looking at suicide rates across our country, Nevada has had one of the highest suicide rates of any state in the nation. I believe back in 2005, before these statewide efforts started, it was around 1 or 2. So we had the highest suicide rate in the nation, first or second. And through the work that has been done, we've been able to improve that slowly but surely. We just received the numbers for 2015, and this came from the American Association of Suicidology, and I believe they get their stats through the CDC, and Nevada is out of the top 10 for the first time ever. So it's a bright spot. We are moving in the right direction. We are nowhere near being done yet. We're still losing people, and we can't stop until we reach 0, and then we need to continue to maintain that. So we have good momentum right now. More than ever, people are willing to talk about it. They want to receive training and education. In the last legislative session, they passed Assembly Bill 93, which mandated suicide prevention training for mental health professionals. So more than ever, we really have some ears that are willing to listen. Back when we first started all of this, it was difficult to get an organization or anybody to sit in a training. And now our folks with the Office of Suicide Prevention and with the Coalition are training all the time.
I love that.
So It's amazing. And like I said, I'm happy about where we are with the number. I'm happy that it's decreasing, and we need to continue to do more. We need to build on the momentum that we've gained and keep going.
I tell you, when I saw that message talking about Nevada suicide rates for 2015, pulling us out of the top 10 for the first time that we knew of. Now we're at number 11. I realize it's not perfect. We're not there yet, but at least we're moving in the right direction. I think I might have stood up from my computer and cheered when I saw that email, because anything positive is worth celebrating.
Absolutely.
We're talking about suicide prevention. Oh man, Nevada, we have so many contributing factors that make it more possible for someone to decide that that was the way that they wanted to end their life. And now I would think that addiction being a huge part of that, to where your demons overwhelm you.
Sure.
And you can't fight anymore. West Care also helps with those addiction issues. You guys can take care of so many things. We always ask, as part of Talking Solutions, what can we do to help you?
We need to keep talking about it. We need to keep spreading the message that suicide is preventable. It's okay to talk about it, and everybody has a part in the solution. We can all make a difference. We can all make a change, whether that's in our own household or in our community or in our state. And really, it's just a matter of being armed with the information that we need to ask a question, to ask a really, really hard question, and to save somebody or help them save themselves from a decision they were getting ready to make.
Suicide sounds like a really tough word to use, but it's very important. It actually just opens up the discussion to talk about it. And that's so important. We were talking about warning signs.
You're looking for somebody talking about suicide, looking for ways to attempt to take their life. Anybody that may be talking about feeling hopeless or worthless, certainly a sense of feeling overwhelmed. Somebody who may be going through a loss, any type of emotional or physical pain, giving away personal possessions and things like that. And withdrawal, we need to make sure that we're paying attention to any changes that we're seeing in somebody that may cause us to be concerned. There are many more, but those are some really critical ones. I'll provide you with a list of some of those so that we can put those up on the website.
From our discussion, what I'm getting is that when someone feels ignored, insignificant, unwanted, I just shouldn't be here, that we need to make them realize that that's not the case. I mean, the whole world is not like the Jimmy Stewart movie, okay? I get it. Everybody loves watching It's a Wonderful Life at the holidays. He was totally suicidal at the beginning of the movie, and then through that crazy set of circumstances and that wonderful story that never gets old in my house,
Sure.
I know, he ends up realizing how much he really has. All cases don't happen that way. We're not all just part of a Hollywood movie, but I think everyone's life is significant.
They are. And one of the things to remember is we talked about risk factors at the beginning. One of the strongest protective factors against suicide is connectedness, being connected to a person, to a pet, to a community. And when somebody stops feeling that sense of connectedness, they're more at risk. If you have to ask the question, are you thinking about suicide? And somebody tells you yes, it's a good idea to listen to where they're at. I think it's very human nature that we want to fix the problem. And this might be the first time that a person has had to talk about what they're struggling with and what they're going through. It's important that we allow ourselves to be in that dark place with them and to just kind of hold their hand through it while they're talking about it, rather than automatically jumping to all the reasons why they have for living. Because in that discussion, we don't want that to end abruptly. And if somebody does say yes and we jump all the way over to, you have all these reasons for living and, what about your kids? And that's all there. But right now they need us to be in that dark place with them and hear all their reasons for dying.
And if we have someone listening right now who is having thoughts about taking their own life, there are resources. Even if no one else is there, the National Suicide Prevention Lifeline is there 24/7. The number again is 800-273-TALK. That's 800-273-TALK. There's always someone there to listen.
You're not alone.
That's important to know. Suicide prevention, the topic today on Talking Solutions. Heather, is there anything that I'm forgetting?
I could talk about this all day.
I love this, the information that you're sharing with us today. This is such an important topic.
Thank you. I'm coming at this from the perspective of a trainer, from a loss survivor, but I also want folks to know that if you are struggling, like I said, you're not alone. I have also struggled with thoughts of suicide in the past myself, and I understand what a dark hole that can be. if we just have the courage to reach out, and it might not look like, hey, I'm thinking about suicide, but just to let somebody know that we're struggling by calling the lifeline, by talking to a friend or a family member, somebody else that we trust, a mental health professional, 911. There's so many resources out there, but from one person who has struggled with thoughts of suicide to another, just know that you're not alone, and please reach out if you're struggling.
All the links, podcast of our discussion today on suicide prevention will be on Talking Solutions Facebook page. Heather Shoop from West Care, thank you so much for joining us today on Talking Solutions.
Thank you.